Here we go. We're live.
Hi, everyone. I'm Sheree Eze of Eze Health Center. Thanks for joining me today. We are about to start our next SculpSure live demo here at my office. I'm joined today by Sheree. She is our sample client for this evening. She's also a member of our team here at Eze Health Center. I'm really excited because a lot of people this time of year, especially after this pandemic, have been struggling with the stubborn body fat, the weight gain, and this is an awesome procedure that really helps with reducing stubborn body fat. What SculpSure is, it's basically a non-invasive fat reduction treatment that helps you lose body fat in areas where it's really hard to get rid of the fat. So for a lot of people, it's around the midsection, it's the inner and outer thighs. We can even treat the chin. So what we're going to do today is have you be able to see what the procedure actually looks like. So if you have any questions at all or any comments, you're more than welcome to leave your questions in the comment area on YouTube, or we're also streaming live on Facebook. All right, so a few basic things about SculpSure is that, like I mentioned earlier, it is a non-invasive fat reduction treatment using lasers. It is a permanent fat reduction treatment. So once we get rid of these fat cells, they're gone forever. I do customize the treatment to your body. So of course, all of us have a different body type and shape, and I'm able to customize the treatment to your specific shape. It is safe for your skin. So even though we're using lasers, it's not going to affect the skin. The laser only targets the fat tissue underneath. The natural looking results. So this is the best part to me. When I had the procedure myself, I treated my lower abdomen, but I saw flattening in my upper abdomen as well. So you're going to see flattening in the areas that we treat and the surrounding areas. And most importantly, it's FDA cleared for treatment. So that's very important. There's a lot of fat reduction treatments out there, but there's only a handful that are actually FDA cleared and approved for treatment. So just to give you an overview of how SculpSure works, if you can imagine, this is your first layer of skin here on top. And right underneath your skin is what we call subcutaneous body fat. That's the fat that jiggles, the fat that we can pinch, okay? We apply the laser to the targeted area. It has a mechanism that's going to cool the first layer of skin, but the laser itself is going to target and heat the fat cells underneath. A portion of those fat cells, up to 25%, are destroyed. And over time, you're going to see that reduction of those dead fat cells. So those fat cells are actually eliminated through your lymphatic system. And you pee out basically those dead fat cells. So they're gone, and they're gone for good. So that's how SculpSure works in a nutshell. And we're going to go ahead and get started. All right. Remember, if you have any questions or comments, feel free to leave a comment. All right, Sheree, are you ready?
Let's go.
Yes. Okay. So what I did, I went ahead and already applied 2 of the lasers on Sheree. We're treating both her upper and her lower abdomen. In these windows is where each of the lasers fit, but it's going to treat up to 2 kind of finger lengths across the perimeter. So even though we're targeting these specific areas, we should see reduction in a larger area around it, okay? So I'm gonna go ahead and put in 2 more of the lasers, okay? It is a 25-minute treatment, so it does not take long. Now, this process is happening in real time. We're destroying those fat cells, but it does take time for those fat cells to gradually eliminate from the body, okay? We're using the body's natural mechanisms. This is not liposuction. This is not surgery, okay? This is what we call a non-invasive treatment. Now, what's pretty awesome about it is after the treatment, Sheree will be able to go on about her day without any major fuss, no downtime, no recovery time required. All right, you ready? Okay, let's go. All right, so these first 4 minutes, you're gonna feel cooling. Then you're gonna feel that mild heat that I told you about earlier, okay? All right. And I should mention, Sheree's also been on our Eze Wellness and Weight Loss program, doing the lipo shots, the appetite suppressants, and the dietary plan. And Sheree, how much have you lost?
32 pounds.
32 pounds on our program.
4 months.
In 4 months. Yay! So what we do medical weight loss here. This will be our 10th year doing medical weight loss here at our facility, and our 4th year doing SculpSure. So what we find is that once people complete our weight loss program and they lost a considerable amount of weight, and they still have problem areas they're trying to get rid of, they end up doing the SculpSure treatment. And what's awesome about it is, with all of my clients who do SculpSure, they're also going to get elements of our weight loss plan. So they're going to get the appetite suppressants, the meal plan, the dietary guidance, the vitamin shots, the lipotropic B12 shots. So you'll continue to lose weight as we're working on targeted fat reduction. All right. How does it feel? Cold, yeah. So first 4 minutes is slowly heating those fat cells up. But it looks like we're doing great.
Yep, I'm awesome.
Yeah. So typically I have, in the room, I try to make it as relaxing and comfortable as possible. So I usually don't have these bright lights on, but just for today's demonstration, we do. Usually have some spa music. Some of my clients like to do aromatherapy, so I might have some essential oils. So just so that they're relaxed during their treatment, because you'll basically be kind of laying here.
I'm good.
You're good. All right. Okay. So we're still in the build-up phase. Now, throughout the entire treatment, everything is precisely timed in regards to the heating. There's going to be the intervals of heat and cooling. The first 4 minutes, like I mentioned, is that build-up phase. We're slowly heating up those fat cells. And then over time, once we get to that peak heating phase, it's going to feel kind of like a pressure or tightening sensation just for a couple of seconds, and then the cooling sets in again. So it's going to be these, intervals and peaks of heat and cooling, okay? The cooling's on the entire time. It's the heat that kind of turns on and off. If at any time, Sheree, it feels uncomfortable, I can always add a little extra cooling, but usually it's just lasting for a couple of seconds. Yeah. Sheree's tough, so she's gonna power through this. Yeah. So I have clients who are very relaxed because it uses heat. It tends to really relax people. So some actually fall asleep during their treatment.
I would do
Yeah.
that.
All right. Okay, so we're almost done with that build-up phase. If you, anyone in the audience, if you have any questions, feel free to leave a question or a comment. Even if we're not able to get to your question on the live recording today, typically I can reach out to you afterwards and send you a message to answer your question. Okay. You're doing great.
I'm awesome.
So, as far as the number of areas we can treat, I would say a good 80% of my clients want to get the midsection done. It tends to be the more stubborn, problematic area that people want to get done. But we can also treat the inner and outer thighs. We can treat the arms, the chin, back fat, the waist. So several areas of the body, anywhere we can pinch fat, that's what we can treat. So any areas here, okay? Now, with Sheree, we're just concentrating on the most prominent area of the abdomen, with the anticipation that we're going to see reduction a little bit on the sides as well, okay?
Amanda would like to know, do you have to previously lost weight to get this treatment done?
Not at all. So you can be at any weight. That's a question that I get a lot. Do I have to be a certain size or lose a certain amount of weight before the treatment? No, you do not. If anything, we help you lose weight during the SculpSure treatment. It's not just getting the treatment and then we're done. I'm including an entire weight loss program and regimen for you as well. So I've treated patients as high in weight as 350, and they've gotten solid results. Now, standard, I do 2 series of treatment. If we are dealing with a considerable amount of body fat that we're trying to reduce, I may suggest 2 or 3, okay? But each time you do a treatment, our expectation is 25%, up to 25% of fat reduction in those areas. I should be very clear though, SculpSure treats subcutaneous body fat. So what that means, that's the body fat right underneath the skin, the fat that we can pinch, the fat that jiggles, okay? Not visceral fat. Right, thank you for the demo. So not visceral fat, so not the hard fat that's kind of closer in internal, a deeper level of fat. So, just to make that clear. Now, one thing that we do for all of our clients with SculpSure is that we do what's called a body composition analysis. And what that is basically a measurement of your total body fat as well as your weight. Now, the machine that we use is called InBody. It does a segmental analysis, so it measures your arms, your torso, and the lower extremities separately, and so tells us how much body fat you're carrying in each of those areas. For the purpose of SculpSure, it really helps guide us to see and confirm that the treatment is actually working. So we do a composition on day 1. So after Sheree's done today, we're going to do her before photos. We're going to do her body composition. And then in 6 weeks, we're going to do that again when she, comes back for her second treatment. All right, you feeling okay?
Mm-hmm. I'm great.
All right. How does it feel?
I don't know. Can't even describe it.
Do you feel the heat
I
a little
feel
bit?
something up here, but
Okay.
it's no pain. Like, it's not hurting.
Okay. So not bad at all. Okay. So over time, I'm slowly kind of increase the level on the laser, and that's really to ensure that we are achieving fat destruction. Okay. But at the same time, I want you to be as comfortable as possible too. So Sheree seems to be doing pretty well here. Good. Good. So yeah, if there's any other questions, keep them coming. We do the assessments each week. We are also having our clients come in, and it's optional, but it's included with the SculpSure package. Our lipotropic B12 shots. If anyone out there is familiar with B12, it's a natural vitamin that helps boost energy for most people. We also would incorporate what are called lipotropic shots with it. So it's B12 plus the lipotropics, which are fat-burning amino acids. It basically helps push the weight loss more, and it helps really push fat metabolism or break down more. So my clients who do SculpSure typically come in on a weekly basis. We offer these injections for free. We do not charge any additional. It's really just so you can maximize the results of their SculpSure treatment. I also start my clients on a detox dietary regimen for the first week or two after their SculpSure to help really max out the weight loss and the fat loss. Total clean eating. We get natural appetite suppressants as well. All of that included at no additional cost. Really, again, so we can get the best results possible. All right, Sheree, you chilling. Very good. So I've got Sheree on a higher setting now, and as you can see, she's pretty comfortable. And we're about close to 10 minutes into her treatment. So we've done, since doing SculpSure, since we started doing SculpSure back in 2017, we've done over 300 procedures. And I could comfortably say with about an 80 to 90% success rate. Part of the reason is we over time have developed unique techniques to really maximize the results for our clients. Also, because we are a medical weight loss center, we incorporate elements of the weight loss program too. Like I mentioned, the natural appetite suppressants, the vitamin supplements, the dietary regimen, and recommendations. So we've actually, over the years, kind of created a book of all of our prior clients with pretty solid results. Now, these first set of photos are actually mine, before and after photos. I had my upper and lower abdomen done. So before I even started offering SculpSure here, I had to make sure that it actually worked. So I use myself as a guinea pig, and in fact, it did work very well for me. So as you can see, this is a different client, different angle. Okay. So each of these clients in the book actually had 1 to 2 series of treatments of SculpSure. This is a client that had just a single treatment of the middle abdomen, but as you can see, we saw a reduction in her lower and upper abdomen as well. So this is after a single treatment. This is another client after a single treatment. She did a what's called a 360, and that's when we do the abdomen, the back fat, and the waist. So kind of all the way around the torso there, okay? Same client, ooh, my book is falling apart here. Same client, she is after single treatment. So as you can see, we have different body types that we treat. You're never too big or too small to get the treatment. We have, this is probably the most common body type in regards to the abdomen that we treat with SculpSure. Kind of large midsection with hanging over lower abdomen, and we tend to see a pretty good reduction there. Now, one question I do get a lot is, with the fat reduction, will we see skin sagging? And we typically do not see that, okay? Not any additional to whatever, if your skin was already loose, it's not going to become more loose because you're getting this treatment, okay? Back fat, problem area for a lot of folks, okay? Definitely helps. Again, these are after 2 series of treatments, okay? And what I mean by series is we could treat the one part, like for instance, Sheree is getting series 1, the first series of her treatment in 6 weeks at our next demo. Well, it might be maybe 6 to 8 weeks. We'll do her second treatment. We'll do the exact same thing. So that's 2 series, okay? We treat men too. All right, so we get a lot of guys here as well. All of my staff, now including Sheree, has gotten the SculpSure treatment. So we can say firsthand that it works. This is Kenyatta. This is her before and after very early on when we first started offering SculpSure. So she had her middle abdomen done. This is after 2 series of treatments here. Okay. So again, a lot of different body types, all different ages. This is one of my older clients. She was actually in her late 60s, early 70s. And she got pretty noticeable results. I mean, her skin, maybe it's the lighting, but her skin even looks younger there in that second photo. Got an older gentleman here. So yeah, one thing that is just awesome about SculpSure is there's no limits in size or shape or weight. We can treat all different body types and shapes, okay? This is one of my favorites. This is one of my older clients. And, I was like, this is almost looks like a completely different person here. Her stomach just really went down very well. So that was always good to see.
Crystal would like to know, do you lose weight or inches or both?
So SculpSure itself is not a weight loss treatment. You will lose inches with this. The way you lose weight is all the other things I add with your SculpSure treatment, which are going to be the dietary plan, appetite suppressants, and vitamin shots. So essentially you will be doing both. This is the SculpSure for the inches and the fat loss, the medical weight loss element for the weight loss. How's it feeling, Sheree?
I'm good.
All right, so I'm steady taking Sheree up on intensity, and she is just chilling. How does it feel now?
I don't know.
Feel good?
All right.
Are you feeling it a little bit more intense
I can
though?
feel it. I mean, I can feel it, but it's not hurting.
Right. Okay.
You feel it, but it doesn't hurt.
Awesome.
It's not hurting me.
Awesome. So, as you can see here, I'm monitoring her
Lighting.
the intensity. You can see that. I'm monitoring the intensity of the laser heat that we're using, but everything's fully automated and precisely timed. The things that I can control more so is at what point we're going to increase the intensity of the heat, and then adding extra cooling. Everything is, again, precisely timed. She has A little less than 10 minutes to go. But yeah, we just kind of sit and wait until she's done. If there's anyone just tuning in, we are doing a SculpSure non-invasive fat reduction treatment today with Miss Sheree, our volunteer, and also a team member here at Eze Health Center. So SculpSure is a non-invasive fat reduction treatment. It helps with reduction of stubborn body fat. Very important to understand this is non-invasive, non-surgical. A question I get a lot is this like cool sculpting? Okay, which cool sculpting a lot of people are familiar with. It's been out there for a while. Cool sculpting is an older technology. It uses freezing and suction to destroy fat cells. Cool sculpting destroys the fat cells, but it can be traumatic to the body because it's using freezing and suction. That isn't a natural thing for the body, whereas heat is a little bit more natural. We're not having to be as traumatic to the skin. We're not going to see any nerve damage or deformity of the skin or tinting of the fat that you typically would see with cool sculpting. My clients walk out with no marks, no bruising, no redness, no issues at all, really. Now, maybe a little bit of soreness the day after the treatment, but very mild, and that typically goes away. Those dead fat cells are in real time actively being destroyed. Over time, your body will absorb it, eliminate it, you basically pee it out. And that's how it works, okay? Now, we typically, for most of our clients, they start feeling changes in about 4 to 6 weeks, or seeing those changes 4 to 6 weeks after their treatment. It takes up to 12 weeks to see your final results. During that time, my clients will be coming in on a weekly basis for their lipotropic B12 shots. We're monitoring to make sure they're doing okay, that we're seeing the results, and it's like slowly shrinking over time. So by the time we do their second assessment and photos, and we show them the change that's happened in just those 6 weeks, it's pretty noticeable by then, okay? But over the time, we're going to be monitoring, your progress. Okay. All right, so I've got Sheree now on the maximum setting here. And it looks like she's tolerating it pretty well. Yeah, excellent. So I think the thing that I think is just absolutely awesome about SculpSure is, I call it the spreading effect. So we're using heat. Whenever heat hits a surface, it tends to spread. So even though the lasers are hitting our position in these specific kind of 4 quadrants here, it's going to treat these middle areas as well, because heat has the spreading effect. It's going to kind of spread across on both sides and also around. So it's not like we're just taking chunks of fat in these little quadrants. It's going to be a reduction all around, and it's going to look natural, right? So even though it's here, up here, you feel that heat a little lower here. So it's actually treating that area as well, okay? All right. You're doing great, Sheree. Rock and roll. We're almost done. We have about 6 minutes left. But as you can see, the procedure is pretty simple. I know when I did my treatment, I literally did it during my lunch break between seeing patients. So it was 25 minutes, just hooked it up, and I was good to go for the rest of the day. I didn't have to go home and recover. There was nothing special I had to do. 3 things that I tell my clients to do to get the best results. Drink plenty of water, okay? The lymphatic system is stimulated when you get, a lot of hydration, kind of helps flush out everything. 2 is regular movement and exercise. Again, that stimulates the lymphatic system to start working, and that's what's used to actually flush out these fat cells. And 3, light massage. Those areas that we treat, those fat cells, once they kind of die off, they tend to clump together before they're broken down and flushed out of your system. Okay. So massaging the area 5 to 10 minutes a day after your treatment is all it takes, okay? As long as you do those 3 things, we're good to go. Another thing is to make sure that our focus is not only fat reduction, but weight loss too. So I don't want you to get your treatment and then go and eat cheesecake and hamburgers and whatnot and think it's all, this is going to take care of everything. I always tell my clients, I don't have anything magical here. You still got to do the work, right? So, of course, and we probably all experienced this. You work out, you get the diet right, you do everything you're supposed to do, but there's still areas on the body that are just not budging the way it should. Now, I know for me personally, I had 2 kids back to back. My precious adoring Chizara. Love them to death, but after the second one, I had a belly. And I still struggle with it every once in a while, especially after this pandemic. But I know even after I had lost the 30 some odd pounds after my pregnancies, the abdomen area was still a problem for me. So it wasn't until I got this treatment that I actually saw reduction in that area. When we exercise, we have no control of where that fat loss is going to come. It just comes off wherever. Some people lose their hips, some people lose their stomach. Sometimes that's the last place where, we'll see the fat loss. But with SculpSure, we're able to actually target where the fat reduction happens, right? So that's the awesome thing about it. All right, so we have about 3 minutes left. Still feeling okay? Awesome. Okay. Now, did you feel that little pressure, squeezing sensation, and then the release?
Yeah, like a contraction.
Kind of like a mini.
Like
But
the Braxton Hicks.
It's right, yeah. Oh my goodness, remember those days?
No, it's been 21 years. I don't remember.
Oh, right. So,
No, ma'am.
oh yeah. So it's if there's any discomfort, it's usually very temporary. Like I said, it's interfaced with the cooling. Yeah, it's pretty quick. So very tolerable for the most part. I know I've had clients fall asleep during their treatment, or they'll be on the phone. They'll be, teleconferencing on, at work while they're doing it. So, I mean, it's you really just kind of sit down and let the treatment work for you. Okay. Any other questions from the audience? Nope. Okay. So we are almost done. Sheree, you're doing great.
Thank you.
So, like I mentioned, after typically when I do the first day of a person's treatment, we'll do a full body composition analysis to be able to measure how much body fat she has segmentally. And in 6 weeks, we do it again to see how well the treatment worked. So we do want to verify that it actually works too. We also do a photo. So we do progress photos. We're going to do her before photo today. And then in 6 to 8 weeks, we're going to do her second photo. And we'll be able to do that comparison side by side. SculpSure is not limited to size or shape. It does not matter how much you weigh in regards to getting if the treatment's going to work for you or not. It will work. The only difference is the more fat we have to treat, typically the more treatments we have to do. The average patient would need only 2 series of treatments. Okay. Right, so we have under a minute left. And then we'll be able to post your before and after photos after the next one. Yes. Yes. So Sheree, after losing roughly about 40 pounds on our weight loss program, she's getting the SculpSure today for the problem areas, the areas of stubborn body fat. And that's the awesome thing about it. And we'll still continue to keep her on the weight loss program as well. All right. So like I mentioned, we've done, here at Eze Health Center, we've treated over 300, 400 patients, about 300 treatments, 300 plus treatments since we started doing this in 2017. And even some of my earlier patients who were amongst our first patients still say that, you know, they look so different now, even all these years later. Some have gained a little weight, but they said they still look smaller, which is awesome because, again, SculpSure is a permanent treatment, okay, permanent fat loss. So that was the bell. We are done. And I want to definitely show you this. So as you can see, we use heat, but you don't see any discoloration, redness, bruising, or swelling on the skin. Okay. Sheree, I want you to feel your stomach. How does it feel?
Like ice.
It's cool to touch, right?
It's cold. Mm-hmm.
It's cold, right? So we use heat, but at the end it's going to cool off. It cools off the skin. So there's not going to be any redness or swelling or any type of deformities afterwards. And that's something that's unique for SculpSure. We don't see that, as opposed to cool sculpting, unfortunately, can cause some slight deformity, redness, and swelling. You just don't see that with SculpSure. Okay, so we are done. Awesome. How do you feel? Awesome. Well, thank you guys so much for joining us for our, looks like this will be our third SculpSure Live, or second SculpSure Live for this year. We do this every 3 months or so definitely check us out for the next one. If you're interested in getting the SculpSure treatment, feel free to call our office to schedule a free consultation. Our number is 240-419-3865. You can also check us out online on theezeway.com. So that's THEEZEWAY.com. There you'll find more information about SculpSure. You'll see some videos and a few of our before and after patients we've actually treated here. So thanks again for joining us. And if you have any questions or comments, even if you're watching this video after our live session today, we'll be sure to get back in touch with you. We are running a special right now, our single for $6, where you get a single area of treatment like Sheree got today for a single treatment, single area for $600. Okay? All right, Sheree, thanks so much.
All right, thank you.
All right. Have a good evening.